All this month, ABC6 is taking a look at the dangers of being hooked on heroin. Fighting Back reporter Steve Levine is in our ABC6 On Your Side Help Center, where we're taking your calls to nab suspected drug dealers and users. Steve?
Yolanda, the phones opened just a few minutes ago, and Crime Stoppers very busy taking lots of calls. They've gotten lots of tips. You know, all this month we are fighting back about getting hooked on heroin. Tonight, how a simple nasal spray is saving dozens of people and lots of folks who've overdosed on heroin and prescription painkillers.
Northbound to West Rich Street ramp.
When Columbus Fire EMS rescue crews prepare to hit the streets, the odds are good they'll be called to a heroin overdose sometime during their shift.
We're seeing the heroin being cut with other medications that actually make it stronger and more potent.
Which is why for years crews have been packing and using naloxone to treat patients, a wonder drug that reverses overdoses.
So what we have here is the medication.
Also known as Norcan, the synthetic narcotic can be used as a nasal spray to block opiate use such as heroin and strong painkillers.
You can actually see the effects take effect and the patients start to breathe better and begin to wake up from the effects of the narcotic overdose.
For years, only medical personnel were allowed to use naloxone, but that all changed recently when a new state law allowed police, treatment centers, even family and friends to administer the life-saving drug. Mary Haven, one of the largest drug treatment facilities in central Ohio, now training its staff to use the drug.
And it works very quickly, has no side effects, and has no potential for abuse.
People outside the medical community must be trained before getting a prescription for naloxone from a health provider. But first responders warn family or friends who use the antidote on someone must also contact 911 to get immediate emergency treatment.
If it's not used properly, yeah, you're right, there is a chance of it having unintended consequences.